What's up, fam? It's your boy called Dimma, and this is the Oral Health Bar Talk. And today's topic will be the effects of oral tattoos on your overall oral health. So it's been like a trend. People like tattoos, and I also like tattoos. And as usual, this podcast is not to discourage anyone from doing any of these things, but then people just need to know the risks, and people need to know how to deal with the outcomes or the risks of having oral tattoos and all of this stuff. So first I'm going to read an article by Benefits Bridge United Concordia Dental, and it is called Managing Wellness, the Risk of Lip Tattoos, What You Should Know. So first of all, they've got 3 points here. The first point is lips are one of the most painful areas to have tattooed. So, obviously. And the second point is that the risk of infection from lip tattoos is high because oral environment is swarming with bacteria. So, the mouth has the most bacteria, and it's just the bacteria that's in the mouth is very malicious, if I can put it that way. So the bacteria in the mouth is very malicious, and so when you get an oral tattoo, you might get scarring, and if you get scarring, and that scarring mixed with the bacteria that's in the oral cavity or mouth, it might cause infections, and you might be more susceptible to infections because of the penetration of the epithelial lining, which is your skin area in your lips or your oral cavity. Yeah, so don't go to Wakanda. Don't come from Wakanda, otherwise you're gonna get infections, bro. And the third of all, it says all tattoos should be done by professionally licensed tattoo artists who uses sterile equipment, which is kind of obvious. So yeah, that's that. So what else do they have here? So it says tattoos have been a popular form of body art for many years. In fact, Statistic Brains reports that 45 million Americans have at least one tattoo somewhere on their body. So it says here are some important things to keep in mind when considering inner lip and lip liner tattoos. Inner lip tattoos. Lips are one of the most painful areas to have tattooed. They've said that the client has to hold their lower lip open and keep it perfectly still during the tattooing process. So I can imagine that's very tedious and painful. And lip tattoos may also last only weeks because of the quick cell turnover in the oral environment. Frequent touch-ups are required. So basically what they're saying is that the cells in your oral cavity, in the epithelium or the lining of your mouth, they turn over very quickly, which means they rebuild and they resurface quickly. So when you get your inner lip tattoo, you might have to go touch it up after a few weeks or a few months because it's gonna disappear. So yeah, Black Panther is inaccurate, guys. Sorry, I had to say it. But yeah, basically what they're saying is that there is a turnover of the cells in your lip. So your tattoo might start to fade and it might disappear. So that's what they're saying. And it says it's common to experience lots of pain and swelling after the procedure. The risk of infection is high because of the mouth harbors hundreds of kinds of bacteria, as I said before. And every touch-up brings the added risk of infection. Eating foods with high acid content like vinegar, tomatoes, and citrus fruits can cause irritation for a time after the procedure. An allergic reaction to the tattoo ink can cause swelling or painful lumps or scar tissue to appear under the skin, which are difficult to remove and can, listen to this, resemble oral cancer. So yeah, guys, there's a lot to think about before you get an inner lip tattoo. So the second type of tattoo they have listed on this website is the lip liner tattoo. So first of all, it says pigments give a natural powdery finish, but since lips naturally exfoliate, the effects only last about 12 to 18 months. So again, with the turnover of the oral cavity, healing time is about 10 days, and the lips will likely appear dry and chapped during that time. Lips are vascular and sensitive, making this a painful procedure, but there is the option of an anesthetic to block the pain. People who are susceptible to cold sores should take preventative medication, since the needle stimulation can cause an outbreak and affect results. So when you're getting your lip liner tattoo, you might want to take antibiotics, and you might want to take some medications, a prophylaxis medication, which is your preventative medication. Because if you have that, if you know you're prone to cold sores, you might get cold sores after this tattoo. So not every skin tone responds well. For example, some darker skin tones can undergo hyperpigmentation and become too dark. While lip tattoos last longer than temporary fillers, they are typically more expensive. So if you don't have that cash, guys, don't get a lip liner tattoo. So there's a section here written long-term effects. So as reported by the Chemical and Engineering News, many individuals don't realize that pigments found in tattoo inks can be repurposed from textile, plastics, or car paint industry. And the FDA has received reports and bad reactions to tattoo ink occurring right after tattooing, and even years later. The source notes localized bacterial infections or blood-borne infections, hepatitis B, hepatitis C, and can be a result of non-sterile needles, unclean tattooing practices, or contaminated ink. So basically what they're saying here is that another thing you need to think about is you need to make sure you get someone who's skilled, talented, and what's the word I'm looking for? Experienced. So you need to find an experienced person to do your oral tattoo, and make sure everything is sterile, everything is going well. Take your medication if you're prone to oral sores. And that's basically what this article is about. So this isn't the only article I have here. I have another article from everybody's favorite oral company, Colgate. So here on the Colgate website, there is a article they have here by one Amy Freeman. It's called A Lip Tattoo, Should You Get the Ink on Your Lips? So here there's a section that says types of lip tattoos. When people talk about getting a lip tattoo, they are usually talking about either tattooing the inner part of the lower lip, or getting a lip liner or lipstick tattooed onto the outer portion of the lip. So as I was saying, the two main ones are your lip liner or your inner lip. So the Wakanda Forever type of tattoo. So a lip tattoo is riskier than other tattoos. As the US Food and Drug Federation points out, all tattoos have risk. The risk mostly commonly associated with tattoos include infection, allergic reaction to ink, and swelling, rashes, or scarring. So the scarring and the bacteria mix up and cause infections, and these infections could end up resembling oral cancer. So inner lip tattoos might be particularly prone to infection because of the high numbers of bacteria that make a home in your mouth. Global News notes that there's also a risk of irritation at the tattoo site, especially if you eat acidic foods such as citric fruits, vinegar, or tomatoes, or if you smoke and chew tobacco. So as I was saying before, if you eat acidic foods, you are most likely to get irritation and pain in the area of the tattoo. So also what they have here is lip tattoo preparation and aftercare. So this is more helpful for you guys to know. There are a few things that you can do before and after getting your lip tattoo to minimize the risk of complications and help the area heal. If you have a history of cold sores, you might consider taking antiviral medication before tattooing your lips to reduce the chance of an outbreak. So as I was saying before, you need to take your medication before you get your lip tattoo. So it's antiviral, not antimicrobial. What did I say? Antibacterial. Just to avoid the HPV, the human papillomavirus, and your hepatitis viruses. Your tattoo artist will most likely recommend that you keep using antimicrobial mouth rinse after you get your tattoo. You also want to be careful about what you eat or drink for the next few days. Some foods may particularly be irritating, such as spicy dishes, acidic foods, and hot beverages. If you're unsure about how to care for your mouth after getting a tattoo on your lips, your tattoo artist can provide guidance and pointers. It might also be a good idea to check in with your dentist, oral hygienist, dental hygienist, to see what they think of it and see if you can offer any tips for caring for your teeth and mouth afterward. So basically the disclaimer here is that this article is intended to promote understanding of knowledge about general oral health topics. It is not intended to be a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your dentist or other qualified healthcare provider with the questions you may have regarding a medical condition or treatment. So yeah, guys, those are the two articles I have for you this week. So my takeaway and conclusion for this is that be careful. First of all, be careful. Pick the right tattoo artist. Make sure that artist is professional. Make sure everything is there. Just make sure. Don't take chances, especially with this type of tattoo, because it might cause infections, and you don't want that. And you don't want those growths. And it might say the infections may resemble oral cancer, but also have a strong feeling that it might also cause oral cancer. I'll do some more research and post it on the Instagram or Twitter site with that information for you guys. But basically, the main takeaway you should learn from this in a lip tattoo fiasco is that just really you need to make sure that you are brushing your teeth, antibacterial mouth rinse, take your medication before if you're prone to cold sores. So the basic thing basically is the scarring part and the infection. You don't want to get an infection in the area because of the bacteria that is found in the mouth can cause that type of infection. So basically what you need to look out for is infections. Make sure you keep your mouth clean and make sure the tattoo is sanitary. Make sure you don't get scarring. Make sure you get a professional looking person and take care of yourself, guys. So that's it for me today from the Oral Health Bar Talk. Next time I will be talking about piercings. And piercings. Yeah, I'm going all emo these days. So we're talking about the effects of piercings on your oral health. And if you like this video and found it informative, click down below. And guys, we're working on the website, so hopefully be able to get these podcasts on the Oral Health Bar website. And that's it for me today. Please subscribe and just smile.